Hi, my name is Leslie Abbott, and I am submitting this video to receive my instructor's certificate so that I can teach students at Jefferson West High School how to give proper CPR, infant CPR, adult child CPR, as well as to be able to use the AED. Here are the books that I will be using. I have my student workbook, as well as the instructor's manual. Both of them are from 2015, and I've done my division sections so that I have all those tabs in place. I also have my first aid CPR AED, as well as I have them on the two separate ones for the CPR AED first aid course. So when you open that up, you actually have the first aid CPR AED and the CPR AED course DVD. So here is my computer laptop that I'll be using, as well as my drive, and I can take the 2016 Heart Saver CPR and I can put it in there. That's going to allow me to play that. And then I also have a projector that it will come out of onto my Promethean board. And so this is what's coming up. We're going to go ahead and get ready to open up the program and view the materials. And so since I'll be teaching the Heart Saver course to our students, this is what's come up off of the instructor CD for Heart Saver, CPR, AED, and then of course they have the first aid there. So here I have put my disc in, and I have my new Mac set up, and it's going to be connecting to my projector, which then shoots onto my Promethean board for my presentation. So this is the CPR AED video that I'll be showing to the class. So this is using the first aid CPR AED disc. There it is, showing up on my screen. Here are our disinfecting wipes and our infant for CPR with the mask and the air valve. Emily, we just got done seeing the video, so now I'm going to go through and demonstrate how you would do it on the mannequin, and then we'll have you practice so you can see how you do. Okay. So when you approach someone, make sure that your scene is safe. You don't want to put yourself in danger and someone else. So just kind of, it just reminds yourself, if you just say the scene is safe, so glass, blood, fire, things like that. Okay. And then you're going to shake him and say, "Are you okay? Are you okay?" You're going to look and check for breathing. You don't see his chest moving at all. Then you're going to tell someone to call 911. Okay? Got that? Yep. Okay. So when we get ready to do the compressions, we want to go about 2 inches deep. And we want to go at a rate of 100 to 120 beats per minute. So I'm just going to kind of demonstrate what it would look like. Okay? And so as you come up here, I like to interlace my hands, but you don't want to lean on the chest totally. You do want to have them close enough that you can put pressure on it, and you want to go deep enough that you can get that 2 inches. Okay, so when you're up here, it's going to be 10, 11, and 12, and 13, and 14, and 15, and 16, and 17, 18, 19, 20, 21, 30. When you grab this, again, remember the C cup that you saw in the video. Tilt the head back, okay? Clamp it there. I like to put my pinky underneath the chin. So as you've given those 2 breaths, you saw that rise, okay? And we're just going to do it again. You saw the lights going off. Does that make sense how it went? So you saw that I missed a couple times. I wasn't probably getting a deep enough depth in compression. So when you're doing it, you're not going to be able to do that with a live victim, but you get used to that habit of knowing how deep you need to go. Okay? All right, so we're going to have you try, and then I'll demonstrate how to use the AED. Okay? All right. So do you have your...
Yes.
Okay. All right. Make sure it's the right fit. Okay. Obviously, they're not going to be on a table. You'll probably have them on the floor. Okay? And so the first thing you're going to do is what?
The area is clear.
Okay.
Okay, and then check to see if they're breathing.
Nope. First you're going, next you're going to say, are you okay? Are you okay? Maybe he's just groggy. We don't know.
Okay.
Right?
Okay. Are you okay? Okay, and then we check to see if they're breathing, correct?
Right.
Okay. All right.
Okay.
And then...
And you might actually get like over the nose when you do that. See if you can hear the breathing and look down at the same time.
Okay.
Okay? So try that. Okay, no breathing. Now what are you going to do?
We are going to do this for 100 beats to 150 a minute.
Okay, 100 to 120, and you'll get kind of that rhythm. But we're going to send someone to go get help. They're going to go call 911 and get an AED.
Okay.
Because we don't know, we don't know how long it's going to be before someone gets here.
Okay.
Okay. All right. So let's see if you can find where your mark needs to go.
And I can just start.
1 and 2 and 3. Count them up.
6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
Okay.
Then I do this.
Okay, so could you see the chest move at all?
A little bit.
So you're going to need to tilt this back further.
Okay.
So we open up the airway.
Okay.
And then put your pinky right about there. And this is called a C shape. Okay? And then see if we can get it to go. Okay? So as you make that breath, you can breathe and look. Okay? All right, go ahead and do your next set of compressions.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29.
Okay?
Just head back.
Good. That wasn't too bad for your first time.
Yeah, it was really
Good job.
Good.
So Emily, let's say that we've been doing our compressions and Alex comes with the AED. Okay, so we're going to finish that cycle, and now we're ready to turn on the AED and to put the pads on first. Okay, and a lot of them will tell you where they go. Okay, they're going to be different for children and infants. So just read where it says, okay? And then we're going to turn it on. And it's gonna drop.
Analyzing heart rhythm.
So now it's checking your heart rhythm.
Do not touch the patient.
So we're going to put our hands up because we don't know who else is with us.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
So it's going to walk
Shock
you through it.
delivered. Begin CPR.
Okay, so I'm going to go ahead and give CPR, okay? Okay, closer. 15, 16, 17, 18, 19, 20, 22, 23, 25, 26, 27, 28, 29. Okay. We're just going to continue that until we know we're just going to listen for the next set of instructions. So we would continue that. It would walk us through it, and it may say, it should tell us what to do next each time. Okay? Put on her. Okay. Okay, good job. Okay, Emily, the AED is here. And look at the diagram so you know where to put it. All right. Push a little harder, maybe. There we go.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button. Shock delivered.
Okay. So go.
Begin CPR.
Okay. So first you're going to do compressions. Out loud.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20,
And you'll notice that it's beeping at a certain rate. That's to help you if you have difficulty keeping a rhythm. Okay, you're a little bit too low. Make sure you're up a little bit higher, right there. Give you 2 breaths. Very good, you did good. And then we would just continue that, following the directions. They may give us, it may ask you to step back because it's going to give another charge. So that was good.